It is a science of practice of the diagnosis, treatment, prevention of disease, and in technical use often taken to exclude surgery. Surgery is not included. Therefore, in that sense, medicine has a broader perspective, and that's how lifestyle is going to fit with the medicine. Then we have the definition given by Henry Sigerist, medical historian. He says, by providing the health and preventing illness, endeavors to keep individuals adjusted to their environment as useful and contented members of the society, or by restoring health and rehabilitating the formal patient. It endeavors to readjust individuals to their environment. Essentially, there are two main components. One is preventive medicine, curative medicine, restorative and rehabilitative components. So this is the broad definition of medicine that we see. Then we have, what is lifestyle medicine? Lifestyle medicine essentially is a branch of medicine dealing with research, prevention, and treatment of disorders caused by lifestyle factors such as nutrition, physical activity, and chronic stress. So that's how the lifestyle medicine has been put forth into the dimension of yoga. And Ripe in 1999, he told that lifestyle medicine involves the integration of lifestyle practices into the modern medical system, both to lower the risk factors for chronic disease, and if disease is already present, serve as an adjunct to its therapy. These are the basic definitions of medicine and lifestyle medicine that we have. With that, we find that poor lifestyle choices like dietary patterns, physical inactivity, tobacco use, excessive alcohol consumption, as well as psychosocial factors like chronic stress and lack of social support and community contribute to chronic disease and all diseases. So modern NCDs are multi-dimensional challenge that we are facing, not only at the physical level, but mental, just deep-rooted psychological conflicts, all at the base of this modern NCDs. And therefore, you need a total approach, a multi-dimensional approach to deal with these things. And that's what you see here. So therefore, in Vivekananda Yoga Anusandhana Samsthan, we took up this thing long back in 1986 itself, when we put this institution's objective to make yoga a socially relevant science. How we can bring yoga as a science of holistic living, as a dimension to deal with the lifestyle changes that we have. How combining the best of the East with the best of the West. We started doing that. And it's here that we have the broad perspective of yoga, not merely as asanas or pranayama or meditation. It's a science of holistic living. Helps us to rise from our normal level to become great, super, divine human beings and reach that perfection itself, that called as Kaivalya by Patanjali, or moksha in the Vedantic terminology, or the dimensions of perfection, having infinite bliss, infinite knowledge. What is that moksha? Absolute freedom. Freedom from all diseases, tensions, stresses, miseries, pain. And it's a state of infinite bliss, infinite knowledge, infinite power, infinite freedom. That is the moksha that's been talked about. Therefore, we all have to read that, and yoga's goal is that. That is the wonderful thing that yoga offers. Therefore, Swami Vivekananda emphasized that is a conscious process. We all use our freedom to consciously change ourselves to grow to greater and greater heights. And that is the dimension of yoga that we have. Yoga is a lifestyle far more than just performing different poses or practicing pranayama or meditation. It's a very rich, encompassing philosophy about all aspects of the art of living. Therefore, Swami Vivekananda brought all the different streams of yoga into the four main streams. You work with the intellect, Jnana Yoga, work with the emotions, Bhakti Yoga, work with the willpower, the Raj Yoga, Patanjali, and bring it to day-to-day life to convert every action into a yoga. That's the Karma Yoga. Therefore, we have four main streams which broadly gives all dimensions of yoga into it. Therefore, we have used this as the key essence. So, we have the Panchakosha, which forms the basis for this total approach of yoga to deal with all these lifestyle changes. And as most of you know, we have been talking about this Panchakosha. I don't have to elaborate. The Taittiriya Upanishad gives us the total understanding of the whole creation. And this is where the Upanishads and the yoga lore differs from the modern science. Modern science is the matter-based paradigm. Everything is basically matter. From there comes up the prana and the mind and the emotions and intellect, and everything is offshoot of matter. This is called upward causation by Professor Goswami. And what does the Upanishad say? Reverse. Consciousness-based paradigm. Consciousness is primary. From there comes Anandamaya and the Vijnanamaya, Manomaya, Pranamaya, and Annamaya Kosha. Matter is the end product of consciousness. This is the main difference. Therefore, emphasized by Professor Goswami, quantum physicist, he always said you have to completely turn tables. And that's what we do. Therefore, yoga talks about this all 5 layers. And when we talk about the lifestyle, it's not only at the physical level, about the diet and then exercises and others, but it's a total approach that we have to look into, that the integrate approach of yoga therapy that we use for the lifestyle changes that we have. And health, as defined by the World Health Organization, we know that we'll be able to get by 2020, second and third of the global contribution to all disease. It has been said that almost 2/3 of the global contribution to all disease will be the lifestyle changes, lifestyle choices. So you can see alarming epidemiological findings of rising prevalence of the chronic diseases we are seeing. But when you look at the definition of health, you know, health is not merely absence of a disease or an infirmity, which is a sense of well-being at the physical, mental, and social well-being, and including the spiritual also into that. So in recent years, this has been amplified into include the ability to lead a socially and economically productive life. That also is an important thing that has started coming up in the definition that I mentioned. So by using yoga as a lifestyle, what are the things that happens? In the yoga journal, he has brought out these dimensions, and also Swami Kovilananda has brought this. What are the things that happen by bringing yoga as a lifestyle? It increases our blood flow, drains our limbs and boosts immunity, regulates heart rate, regulates blood pressure, regulates adrenal glands, boosts the sense of well-being, and we have promotion of peace inside. That is the most important thing. Mana prashamana upayaha yogaha, as it is said. And therefore, Swami Vivekananda emphasized that we have to start changing by which our lifestyle is going to change. To change our lifestyle, it's very difficult. Habits die hard. Therefore, what to do? Personally gave the things. You calm down the mind, silence the mind, mana prashamana. When you start doing that, the entire lifestyle can change. You get control of the diet and you get all habits done. That's the main thing that we have. Therefore, we have the central illustration, overflow of lifestyle factors that may contribute to the risk of heart failure and opportunities to therapeutic intervention. You can see poor quality of lifestyle featured by poor quality diet, and we have the dimensions which are causing hypertension, diabetes, dyslipidemia, sleep disorders, and others, and can lead to all these things. Agarwal has brought this thing in the Journal of American Relation dimension. And the behavioral intervention strategy is important, and therefore, when you study the population, shows that behavioral interventional changes can bring about this thing. Sustained changes in physical activity and clinical outcome in patients with type 2 diabetes has shown that lifestyle changes can bring a lot of changes. So recommendations by the gold standard chronic disease management care, the American Diabetic Association says, yoga is as a physical activity, a milder form of exercise, and that's where they did not mention too much about the relaxation, with significant impacts on AAC, flexibility, muscle strength, and balance. Then American Heart Association talked about the large trial finds yoga boosts quality of life, returns to activity, and adds to emerging evidence for rehabilitation alternatives, circulation. So the dimension, the benefits goes further to management skills and to use nationally recognized practice guidelines, establish effective relationship with patient. All these benefits start coming up in the clinical integration of yoga. So yoga as a lifestyle is shaping up, and how it can bring about office and community support, have the ability to practice in interdisciplinary and community teams, and use appropriate community referral resources also to support. So these are all the things how yoga as a lifestyle can be brought forth into the clinical practice. So Ayurveda also brings about a complete knowledge for the long life, and we have the various dimensions brought out, and it is at the basis in Atharva Veda, and many of our Ayurveda friends are going to explain these dimensions. Therefore, in general, we have yoga as a lifestyle change can bring about all the necessary benefits to deal with the modern NCDs because yoga is multidimensional. It brings about the complete control and mastery at the physical level, prana level, mind level, emotional level, with the psychological dimension. Therefore, the four streams of yoga could be extremely useful, and this is how we do that. So, we are going to have a lot of presentations about various evidence base that has been accumulated in the world. We have all top experts coming. Already you saw how Dr. Gangadhar has been to show how yoga as a lifestyle can bring changes in the brain itself. The biomarkers are coming up. Similarly, we got our Dr. Gautam from AIMS. He's going to talk about various dimensions, and Dr. Manchanda is there, and Sabir is there, Dr. Nagaratna. They are all going to bring about the evidences that have accrued due to the lifestyle changes, which is very important. We're in the age to deal with the evidence base. So this conference is going to bring about. Therefore, I have not brought out those dimensions into my presentation. So once again, thank you all very much for your patient hearing.
Thank thank you, Guruji, for such an insightful talk. Next, I'm pleased to introduce Dr. Gautam Sharma, Department of Cardiology, All India Institute of Medical Sciences, New Delhi. He's a professor and in charge of Center for Integrative Medicine and Research at All India Institute of Medical Science, New Delhi. Dr. Sharma did his MD in Internal Medicine from PGIMER, Chandigarh, and DME in Cardiology from AIMS, New Delhi. His postdoctoral fellowship was in Cardiac Electrophysiology from Royal Hospital, Australia. He is a senior interventional cardiologist with expertise in complex coronary intervention and radiofrequency ablation for cardiac arrhythmias. He has authored several scientific publications in leading peer-reviewed journals and is a regular speaker at national and international cardiac electrophysiology conferences, focusing on arterial fibrillation. He is passionate about integrating yoga and other Indian traditional healing system with modern medicine. I welcome you, sir. The dais is yours.
Thank you so much for your kind introduction. So, much of what I had to say, or at least some of what I had to say, Dr. Nagendra has already covered, and so it'll make my task easier. But I'm essentially going to speak about the relationship of stress to cardiovascular disease and how yoga as a lifestyle intervention can help modify that. So, till we are waiting, I actually thought that I'll begin with the clinical case for all the medical students who are here. It'll make it interesting rather than just talk about theory. So I've got a couple of cases that I wanted to share with you, which illustrate how stress affects the heart. And I hope the slides work. Yeah. Anyway, I'll start off with the case while they're loading the slides. So just recently, a 56-year-old lady who's actually a colleague of ours at the All India Institute presented to the emergency department with uh, chest discomfort, severe anxiety, palpitations, profuse sweating, and uh, all this was preceded by a severe altercation with a fellow a colleague. And so she had tachycardia, blood pressure was low, she had tachypnea, and within minutes there was worsening, and she collapsed, and she had to be intubated, and she had to be cardioverted because she had abnormal ventricle rhythm. So this was the ECG. The ECG did not show a classical ST elevation, but it had enough signs to suggest ischemia. And this was the echo that was done at bedside because the ECG was not clear, so we did an echo. And you can see this is for the medical students here. This is the left ventricle. Where is this is the pointer? The pointer is not clear, but this is essentially showing that the left ventricle is contracting so poorly. So the and the last image, the bottom image, is a cross-section area of the left ventricle in a circular fashion to show that the contraction, which should be very vigorous, was very poor. So with this, we did a cardiac enzyme. Sorry. Can you go back, please? So we did a cardiac enzyme, and cardiac enzymes were raised. And all the medical students here know that if you have chest discomfort and cardiac enzymes are raised, what is the diagnosis? Yes, MI.